When examining the distal limb, it is important to start the examination with the foot in a balanced and weight-bearing position. Determining the appearance and conformation of the toes in relation to the left and the right side, determining whether toes are flattened or sprung with dorsal elevation, all is helpful in determining the presence of Manus pathology. When examining the antebrachium, it is wise to elevate the leg and begin your palpation with long bone palpation of the radius and particularly the proximal ulna. When looking at the joint, the carpal joint, the radiocarpal joint, we will flex the carpus. The foot should be able to touch the caudal aspect of the antebrachium. Full extension can also be performed and should be pain-free. When palpating the radiocarpal joint, at 90 degrees, the joint will be open and exposed, and the presence of effusion can be determined. Palpating for stability requires lateral pressure and medial pressure with the limb in an extended position and also in a partially flexed position. The palpation should then descend down to the metacarpal bones and the middle and distal row of carpal bones. It's wise to feel those long bones carefully, then move to the junction between the metacarpals and the first phalangeal joint. D5, D4, D3, and D2 joints should all be palpated thoroughly and a determination of thickening of the joint areas made. Digits should be extended sequentially and completely and flexed to determine the presence of digital pain. The foot itself should be flexed and extended and a good examination of the undersurface performed, looking for pad pathology, determining the presence of dermatitis or pododermatitis is all helpful to differentiate the cause of a foot-based lameness.